Good evening, everyone. And I'm Dr. Kashyap. I'm a consultant psychiatrist from Bangalore. And a very warm welcome to all of you for this talk today evening. Today, I'll be talking to you about an illness which is often overlooked, misunderstood, but affects a staggering number of people. And that's depression. Depression is not just about feeling sad or having a bad day. It's a fairly serious mental health condition that affects millions of people worldwide. So in this presentation, we are going to delve into the intricacies of depression. We are going to explore its causes and symptoms. And we are also going to discuss some of the strategies that are available to us to manage depression. So I hope that by the end of the talk today, all of you will have a deeper understanding of depression, and you will be empowered not only to help yourselves, but also be able to identify the illness in your loved ones and also help them who are struggling with the illness. Right. So before we kind of go into the meat of the discussion, I'll just talk to you about a little bit about the commonly used terminologies. I'll also talk to you about the difference between sadness and depression, and then we'll go into depression per se. All right. All of us have used words like mood and emotion, but have you ever kind of stopped and kind of wondered what it is meant by the word emotion and the word mood? Right? So let's talk about emotion first, and then we will talk about mood. Emotion is an intense feeling which is usually linked to a particular event or a stimulus. All right. It is something which lasts only for a few minutes, at the most a couple of hours, not more than that. And it has three very essential components to it. The first component being the subjective experience, meaning something which is produced by the individual's mind and experienced by the individual himself or herself, as opposed to an objective experience which is experienced by everyone else and it can be observed. The second component is a physiological response that is generated in the body, right? So suppose, say, for example, you're anxious, you feel that your heart is racing, you're perspiring, your hands and legs are trembling. That is the physiological response. That is a response that is generated by the person's body. And finally, a behavioral response. The behavioral response refers to that which can be observed by others, right? So something which if the other people can see, and then you know it's an emotion. Like say, for example, a person is sad. The behavioral response could be that they are crying. So that's something which can be observed by others. So just to recap, emotion is something which lasts for a very short duration, as opposed to mood. Mood refers to an overall emotional state, right? Something which is not by definition linked to any external stimulus. And typically it lasts for weeks, all right? Weeks, especially days, and more than days, it typically lasts for weeks. So that is referred to as mood. And coming to affect, affect is very closely linked to the behavioral response of an emotion. So something which can be observed by others and which can be validated by others. So mood, emotion, and affect, these are the three words that I would want you people to keep in mind as we go ahead, because everything else is kind of based on these three words. All right. So now, what is sadness? I mean, all of us have felt sad, haven't we? And sadness is something which is a normal human emotion. All right, it's normal. Imagine a world wherein there was no sadness. It would have been extremely difficult to process all the negativity that comes across our way. All right, and it would have become extremely difficult to find a sense of closure if there were no sadness. So sadness is something which is normal, and all of us have experienced sadness. And it is absolutely essential for our well-being, mental well-being. All right. It has two very important components to it. All right. Sadness, as opposed to depression, has two important components. The first one being that it is temporary, meaning that you do things that you like, especially self-care, going out with people, talking about your sadness, all of that lifts the sadness, meaning you start feeling better when you kind of talk about it, when you share it with others, and when you do things which kind of make you feel good. The other component of sadness is that there is no socio-occupational dysfunction, meaning there is your work performance, your interpersonal relationships are not affected, and finally, your self-care is not affected, meaning you no longer, you don't neglect yourself. You still kind of brush, bathe, eat, talk to others. All of those things are intact, as opposed to depression, where all of these things can be potentially affected. So what is depression? So if you can recollect, I use the word mood and emotion, right? Emotion is something which is cross-sectional, meaning what is seen at any given point in time, as opposed to mood, which is longitudinal, which is lasts typically for several weeks. So depression, clinical depression, which is also known as major depressive disorder, is a mood disorder, something which by definition lasts for more than 2 weeks. All right, 2 weeks. That's a key point that you people need to keep in mind. The cardinal symptoms of depression are sadness, and the sadness is described as a persistent, pervasive sadness. Pervasive meaning it kind of permeates every aspect of your life, meaning it infuses every aspect of your life. You might be kind of cycling, you might be working, you might be talking to others, but this is constantly there in your mind. You're constantly sad. That is what is meant by pervasive. And the second component of depression is something known as anhedonia. Anhedonia refers to loss of interest in activities that you would normally enjoy. I like to cycle, I like to play the violin, I like to kind of go out for an exercise. All of those things, I no longer am interested to do all of them. That is anhedonia. All right. And typically it causes significant problems in multiple spheres of life, especially in work performance is affected, your interpersonal relationships are affected, and finally, even self-care is affected. That is what is meant by significant socio-occupational dysfunction. All right. So these are the two symptoms I want you people to keep in mind: the persistent, pervasive sadness and the anhedonia, which are the cardinal symptoms of depression. Of course, there are multiple other symptoms which we will talk about in greater detail as the presentation goes on, but these are the two symptoms that I want you people to keep in mind. All right. So coming to some important points that I would want to kind of talk about with respect to depression is that crores of people in India are affected by depression. Nearly 1 in 20. There was a recent study which was done about 2 years before the onset of COVID. And that study said that nearly 1 in 20 people are having depressive symptoms in India. And after COVID, the numbers have only gone up. The numbers have only gone up, right? So the prevalence of depression is about close to 5%, and close to 6 crore people in India are affected by depression. And unfortunately, females are more affected than males. In fact, if you're a female, the chances of you developing depression are 2 times greater as opposed to if you're a male. All right. And there are some reasons for this particular statement. All right. However, these reasons are not proven, but there are very good studies which back up these claims. So the first reason is genetic. Genetic meaning if you're a woman, you have an X and a Y chromosome. I'm sure all of you know that. And if you're a male, you have a one X and Y chromosome, and in females, 2 X chromosomes. All right. So some of the genes which code for this particular illness are located on the X chromosome. So if you're a woman, you by definition have 2 X chromosomes, and therefore the genetic loading, meaning the number of genes that you've inherited from your parents, are more as compared to a male who has only 1 X chromosome and has that many fewer genes for depression. All right. So that's the first reason why women have more chances of developing depression. The second one is hormonal differences. Women have more hormonal fluctuations over their lives as opposed to men, especially in the premenstrual phase, that is 1 to 2 weeks before the period starts. during pregnancy, immediately after childbirth, and of course in the menopausal phase, wherein there are a lot of hormonal fluctuations which predispose them for depression. And then there is a very fascinating concept known as learned helplessness. Learned helplessness was a term which was coined in this way back in the
Hello.
60s by a person named Martin Seligman. All right. So he did some really fabulous experiments. So the gist of what he did was that, like, say, for example, a stressful event is thrown at you. What would you people do? Generally, we muster up all our coping mechanisms, right? We talk to people, we think about how to kind of go about coming out of this particular stress, and then we put in all our attempts and efforts to overcome this stress. Now imagine all of those attempts go in vain, meaning you are met with defeat and failure. You get dejected, and then you tend to move on. But if this were to happen repeatedly, meaning your life throws multiple stressors at you, and most of those stressors lead to failure, right? Or most of it leads to defeat, then what happens is your brain tricks you. It tricks you saying that, what's the point putting effort? Anyway, failure is inevitable. So your effort would be meaningless. So consequently, in the future, when a stress is when you're confronted with a particular stress, you no longer make any attempts to overcome that. Even if an exit route is presented to you, your brain tricks you, telling that, why do you even go there? You're definitely going to fail. So that concept is known as learned helplessness, and it's one of the causes for depression. All right. And the mean age of onset of depression is generally about, say, 40 years. But recent studies have shown that this age is coming down progressively. In fact, we have more and more people who are in their 20s and 30s who are developing depression, as opposed to people who are more than 40 years. Now, I think we've already spoken about the genetic causes. So just to kind of recap the causes for depression at the genetic level, more than 100 genes are implicated. But unfortunately, none of those studies which identified specific genes have been replicated, which means that we cannot definitively tell that, this particular gene is responsible. For some individuals, it might be responsible. For many others, it may not be responsible, right? And think of depression as what causes depression. If someone were to ask you what causes depression, think of depression as a gun, all right? The genes load the gun, but the environment pulls the trigger, right? So the genes load the gun, environment pulls the trigger. So both are required to cause depression. So if you don't have the genes for depression, you are not going to develop depression, however bad your environmental circumstances are. But we do not know who has the genes and who don't have the genes. That's unfortunate. Maybe in the coming few years, we might be kind of developing kits, genetic testing kits, which might kind of identify these genes. But till then, there's really nothing much that we can do about it. Coming to the environmental factors, I refer to stressful life events. These are the environmental factors which trigger depression. And stressful life events specifically refers to 3 stressful life events. First one is losing a parent before the age of 11. The second one is the death of a spouse. And the third one is losing a job or unemployment. Now, there are a whole lot of other stressors which can also cause depression, but these are the big bad ones, right? These 3. And generally speaking, depression is an illness which hits you in waves, meaning you're going to have multiple episodes of depression over your lifetime. But what happens is these stressful life events are generally responsible for the first episode of depression. So when there is a stressful life event and you have the genes, you develop depression. And that triggers certain changes in the brain, meaning it depletes the level of certain neurotransmitters. Neurotransmitters they're also known as chemicals, all right? Chemicals in the brain. Different parts of the brain have different sets of chemicals. So it depletes a certain set of chemicals known as serotonin, which is also known as the happy hormone, and also another chemical known as norepinephrine. All right. These are the two chemicals which are depleted, especially in the front part of the brain and also in the side of the brain. All right. In these two areas, these two chemicals are completely depleted. And then that finally results in the symptoms of depression, which we are going to talk about a little later. The subsequent episodes of depression need not have stressful life events, meaning you are having depression, you get yourself treated, you come out of depression. Maybe 5 years down the line, out of the blue, there's another episode. It doesn't mean that you need to have a stressful life event to cause the second episode. It can happen on its own, right? So the unfortunately, depression hits you in waves, and the stressful life event is usually precedes the first episode, not the subsequent ones. Coming to the symptoms of depression, I think we have already discussed the mood and the anhedonia part of it. There are the other symptoms, which include sleep disturbances. Typically, the sleep is reduced. And when I say sleep is reduced, sleep disturbance can be of three types. All right. The first type is you're unable to fall asleep. The second type is you're unable to maintain the sleep. And the final component is there is early morning awakening. Early morning awakening refers to a person awakening at least 2 hours before their normal waking hours. So say, suppose I were to wake up at 6 o'clock in the morning. So suppose if I were to start waking up at 4 in the morning, that could be one of the symptoms of depression. All right. The sleep can also be increased, and I'll talk about that a little later. Changes in weight typically refers to weight loss of at least 5% over a period of 1 month, 5% in 1 month. The other symptoms include loss of energy, unable to concentrate, poor memory, depressive cognitions. Cognitions is a very depressive cognitions are a very unique phenomena, which I will talk about a little later, because all of us have been victims of cognitive distortions, not just people with depression, right? I'll talk about that a little later. But in depression, the cognitive distortions include distortions about the self, that is worthlessness, distortions about the future, that is hopelessness, and distortions about the present, meaning helplessness, that you feel helpless, right? And a couple of other symptoms which include are psychomotor retardation, meaning the psychic activity and the motor activity are decreased. Psychic activity refers to poverty of thoughts and poverty of content of thoughts. And motor activity refers to you not doing things which you were previously doing, right? Meaning going out, talking to people, going out for an exercise, going out for your job. All of that requires motor activity. All of that is reduced. And finally, if the depression is severe, then it actually can lead to thoughts about harming oneself, right? Suicidal thoughts. These are really dark thoughts and signifies that the depression is quite severe. Okay. Now think of depression as a tree, right? The tree has multiple branches, right? And all of these branches refers to specifiers in depression. All right. So depression can be mild, moderate, or severe. I'm not going to go into the details because it's really beyond the scope of this discussion here. Then there are something known as melancholic features. Melancholic features are unique because the person feels terrible at the beginning of the day. So you wake up and you're really feeling bad. All right. You feel that the world, is like there's no point living life. But as the day progresses, you start feeling better. And typically by evening, they are quite good. They feel quite good about themselves. That refers to as melancholic features. Of course, there are other symptoms which I think you can read, and I don't think I need to talk about it because, again, it's beyond the scope of this discussion. Then there are atypical features. Atypical features is all the symptoms of depression with increased sleep and increased appetite, as opposed to decreased sleep and decreased appetite. That's the atypical nature of depression. Psychotic symptoms refers to a break from reality, wherein people start hearing voices which are not heard by others, which are known as hallucinations, or having suspicions which are false and fixed, and they are known as delusions, right? Those are psychotic symptoms. Depression can also be postpartum in onset, meaning it can happen within 4 weeks of childbirth, and that's known as postpartum depression. Depression, which occurs typically in the months of November, December, and January, are known as seasonal affective disorder. They are really good in the summer and spring and summer, but the depression starts every year in the winter months. That's seasonal affective disorder. And then there is something known as premenstrual dysphoric disorder, PMDD. PMDD is nothing but depression, anxiety, and irritability, especially in the premenstrual phase, seen in women. That is 1 to 2 weeks before the period starts. And typically, they start feeling good about in a week's time after the period starts. So that's known as PMDD. It affects about 10% of all the women. Right? So coming to cognitive distortions is a very unique phenomena, right? All of us are victims of cognitive distortions, right? There are more than 50 cognitive distortions, by the way, and I'm going to talk about only a few of them because they are applicable to depression, and others are seen elsewhere, which is really not applicable here. So the first one is minimization and magnification, right? Minimization refers to you minimize your achievements, and magnification refers to you magnify your failures, right? So say for example, you passed an exam, you tell others that, I mean, it's really nothing much because I've just kind of scraped through, although you've scored fairly well. Or if you failed an exam by just a few marks, you tell others that I've totally lost it, wherein the reality is completely different. Overgeneralizing is taking one detail of one particular event and kind of applying it for all other events, right? So if a teacher sees one student who's sleeping, she then starts to think that, my class is boring and nobody's interested. That is overgeneralizing. And then there is something known as selective abstraction, right? So say, for example, in a particular event, there are multiple details which are there. So this particular individual focuses on one particular detail while ignoring all the other details. Like say, for example, in a year, you have kind of achieved a lot in your work, right? You have finished a lot of deadlines and you've been kind of promoted. But then there is one particular failure, which then you start focusing on that while ignoring all your other achievements in that particular year. That's known as selective abstraction. Personalization refers to taking personal responsibility for collective failure, right? So the whole team is kind of fired, but then you start wondering it's because of me. That's personalization. Arbitrary inference refers to coming to a conclusion without any basis in reality, right? Say, for example, you go on a Monday and you join work on a Monday, and then you really are not happy with the work and then you quit. Then you start thinking that, okay, if I join work on a Monday, then the same thing's going to happen. There is no basis in reality, but then you start to think in that direction. That's arbitrary inference. Dichotomous thinking refers to black and white thinking. Life is usually is in the varying shades of gray, right? Varying shades of gray is what defines all of us. But people with dichotomous thinking, they think in a way that, everything is right or everything is wrong. There's nothing in between. So that is known as dichotomous thinking. Catastrophization refers to thinking the worst case scenario at all times, right? Say, for example, your heart rate is increased because you're anxious. You start to think that, oh my God, I'm having a heart attack. And that's it. My life is going to end. So you're thinking about the worst case scenario all the time. That is known as catastrophization. So cognitive distortions is something which I think you people, if you are kind of think a little bit about how you are kind of approaching various life events and various life stressors, I'm sure all of you will be able to identify these cognitive distortions even in your lives. You may not be depressed, you may not be anxious, but we have all been victims to these cognitive distortions. Now, coming to treatments, a lot of people know that they are affected by these symptoms, but they are reluctant to seek help. That's the unfortunate part of all mental illness, not just depression. Just to give you an overall picture as to what treatments available are, the first and foremost is what we advise. Those are medications. Medications are proven, they are safe, and they are effective. All right. So many people ask me, what about what about the side effects of medications? Will it damage my heart? Will it damage my liver? Will it damage my kidneys? The answer is no, absolutely no, right? these medications are safe and they are proven. There are a certain sections of populations in whom we will have to be careful with the medications, especially those with renal failure, that's a kidney failure, those with the failure of the liver, and all the other organs when they are failing for other reasons. In those cases, we need to be a little careful with the medications, and that's where our expertise kicks in, right? So we tend to kind of make sure that we select certain medications which are heart friendly or liver friendly or kidney friendly or whatever be the scenario. So medications is one option. Some people also ask me, what are the commonly seen side effects of medications? Generally speaking, these medications are very safe, and some of the commonly seen side effects are gastritis-like symptoms, wherein you have symptoms like pain in your belly, changes in bowel movements, either you're constipated or you're having diarrhea. Some people can also become nauseous, meaning they may have some vomiting also. So these side effects are generally self-limiting, meaning you take the medications, you have these side effects. Within 3 to 4 days or within a week, these side effects generally tend to settle down. That's about medications. The second form of treatment is known as psychotherapy. Psychotherapy is loosely known as talking treatments. Talking treatments essentially deals with three aspects, all right? It deals with your thoughts, it deals with your emotions, and I hope you remember the definition of emotions. Emotion is something which is cross-sectional, something which lasts for a few minutes to a few hours. And of course, it deals with behavior, all right? So the underlying theme of psychotherapy is that if you change the way you think, in all likelihood, it's going to change the way you feel, that's emotions, and change the way you behave, right? So you are operating at the level of thoughts and you are changing the way you think, meaning you're identifying the cognitive distortions. You are replacing those distortions with healthier thinking patterns. So faulty thought processes are converted to healthier thought processes. And thereby, you change the way you feel about yourself and you change the way you behave. So that's the essence of psychotherapy. So psychotherapy, there are multiple therapies. That is, there are cognitive behavioral therapies, there's interpersonal therapy, there's family therapy, a whole lot of therapies. Okay, I think that's beyond the scope of this discussion, and I think we just leave it at that. Then there's something known as ECTs. ECT stands for electroconvulsive therapy, right? This is the gold standard of treatment of depression. Gold standard, meaning it beats all other forms of treatment by a mile, right? So what happens here is we get the consent of the patient. We admit the patient overnight. We keep him nil per oral, meaning we don't allow him to take anything through the mouth after, say, about 8 hours before the procedure. We get the anesthetist's opinion, and then we sedate the individual, meaning that he goes to sleep, right? Once the patient is asleep, once he's anesthetized, a small electric current is given across the brain. So you have two probes which are kept on the skin here, on the temple, on either side, and a small electric current is passed into the brain. So this is, it is shown that the chemical imbalance, which I was talking to you earlier, that there's a depletion of certain chemicals in the front and the side of the brain, they are kind of boosted. So we increase the level of those chemicals by giving a small kind of a shock to the brain. Of course, it sounds very scary and kind of very inhumane, but it's not. It's not. It's a proven treatment, and it works when other forms of treatment are not working, right? So the patient does not feel any kind of pain. And generally speaking, there are no lasting side effects. Some people do have transient headaches and vomiting after the procedure, but it settles down within a couple of days, right? ECT is a proven treatment, and many of you might already be aware of this particular treatment. The other treatment is something which has come more recently, which is known as RTMS. RTMS stands for transcranial magnetic stimulation, and the R stands for repetitive transcranial magnetic stimulation. So what happens is, this is a non-invasive procedure, but this is a very expensive procedure because it has come out fairly recently. It's quite expensive, wherein you go into the office, wherein you go into your psychiatrist and you sit on a chair. and a helmet is put on your head. It's the helmet, what happens is it sends magnetic waves to the front part of the brain, right? There is no contact with the brain. It just sends magnetic waves into the front part of the brain. By doing this, it raises the levels of those chemicals which are depleted. So that's RTMS. Again, the side effects of RTMS are the same as that of ECT, which is transient headache and some amount of nausea in some individuals, not in all. That's a very rare side effect. But headache is likely to be seen for a few days. So what's the course of depression? I mean, what happens if you just leave it? I mean, it can go on for at least about a year or so, right? Before it kind of subsides. It may not subside completely, but some of the symptoms generally tend to go away. But if left untreated, 6 to 13 months is the duration of an untreated illness. But if it's treated, the maximum time that's required is about 3 months, right? Usually it's less than 3 months. For some people, it's starts at 3 months, and for some people it goes on. It may take a little longer. There are multiple factors which affect, meaning, say, for example, they've had multiple episodes of depression. If they have the other specifiers which I've mentioned, meaning the psychotic symptoms, if they have comorbid substance use, especially alcohol and tobacco, and the other things like if they are suicidal, all of these postpone or prolong the treatment duration. And what is the recurrence rate? Recurrence rate is 50, 60, and 70%. So if you have had one episode, it's 50% chance that you will have it again. 2 episodes, 60%, and third episode is 70%, right? So the more episodes you have, the more likely you're going to get it again in the future. So when do we stop treatment? That's a question which many people ask me, right? So can we take the medication for a month, or can we take it for a couple of weeks and then stop? The answer is no. You need to take the medication for at least 9 months after you're completely symptom-free. Say, for example, the depression starts in the month of May, right? And you started treatment and the depression is kind of completely come under control. The symptoms have completely come under control in the month of July, right? So from July, you need to take the medication for at least 6 to 9 months, right? For you to become completely free of depression. So a total treatment duration is generally about 10 to 12 months. That's about 1 year. But if you've had multiple episodes of depression, then the treatment duration progressively increases. Some people say it's about 2 years and some others say it's 5 years. A number of factors are again taken into consideration. Say it's the third episode. I'm not going to stop the treatment at 1 year. I'm definitely going to go on for about 3 to 5 years. And if there are other events, stressful life events like losing a loved one, or if he or she is consuming alcohol, all of that again adds to the treatment duration, right? So why is it a stigma? Stigma is something which is unfortunately still seen in our country, unlike the West. Stigma refers to negative attitudes or discrimination against people who are having mental illnesses, right? There is different types of stigma. There's the self-stigma, meaning the stigma which an individual with a mental illness has about himself. Then there is professional stigma, meaning stigma which is seen in the workplace. Then there is public stigma, meaning that which the person experiences because of the people around him in the general public. And of course, institutional stigma. This is seen in institutional level, right? And the core of stigma, the reason for stigma is a lack of awareness about the particular illness, right? They don't know what the illness is. They don't know what the symptoms are. They don't know the causes of these particular symptoms and the illness. And therefore, they start assuming. They are assuming all kinds of rubbish, which kind of only adds to the patient's suffering, right? So ignorance is the biggest cause of stigma in our country. And of course, out of ignorance stems portrayal of mental illness, right? Especially in films and in the media, especially. Wherein they don't give an accurate representation of what the illness is. So media influence stemming from ignorance is one of the biggest factors because of which depression is still a stigma in our country.